So in this segment, we have set aside some time to answer some questions. So these questions were collated from everyone during the registration process. So there were a lot of them. I just chose about a few of the top asked questions. So the first one is, can a fully vaccinated person with booster shot still acquire long COVID?
Yes.
One person shared their experience, like they're fully vaccinated and boosted, and then they were positive in February and they're still tired. Like, is it considered long COVID?
Okay, so infected, I like you to wait for about 3 months before you call it long COVID. Now, can fully vaccinated persons still acquire long COVID? The answer is yes. The good news is that by being vaccinated, your risk has reduced down by half. We can't quantify long COVID, but I suspect the long COVID will be better off than compared to unvaccinated. So short answer, yes, you can still acquire long COVID, but your risk is reduced down by half. And I suspect it's going to be milder, hopefully, compared to someone who's not vaccinated. Or if let's say there's a twin or your twin doesn't get vaccinated and gets infected, chances are it's going to be worse. Okay, next question.
How does long COVID affect children below 5 years old who cannot get the vaccination? I know you touched a bit about the children, but
that's a big problem. And unfortunately, it can happen. We don't have vaccines yet, and not that the vaccines cannot be given, but we don't know whether are they efficacious. What's the point of giving the vaccine where it doesn't work? So they're trying on 3 doses for children that are less than 5 years old. But at this point in time, there's really, really very little we can do. You're right, children less than 15 years old can get long COVID. There's no vaccination. You're really stuck in a situation. Unfortunately, I don't have a good answer until the vaccine comes along. Sorry.
Okay, let's just go to the third question. So does having a chronic illness, some of them that they put in the registration process include something like kidney disease or remission, cancer remission. Does it change the way COVID affect the body? Like, are they at a higher risk of getting long COVID?
Great question. The answer is yes. The more comorbidities you have, the more less strong you are physically, the less ability you are to walk normally, even run and do exercises, the more likely you're going to get long COVID. So if you're on kidney dialysis, you're in cancer remission, but you don't have an active lifestyle because your cancer has limited you, you're more likely to have a severe form of long COVID. You're more likely to have long COVID than someone equivalent to you, but without that problem. So the answer is yes, you do have a higher propensity for long COVID. Chances are it's going to be a little bit more tiring and longer. Sorry. Yeah. Faith Teo asks, is the Lian Hua pills useful? If you look, there are actually studies that are conducted to look at the Lian Hua pills. They do report that the symptoms are better. The symptoms are better compared to not taking the Lian Hua pills. But it doesn't make a difference between admitting to ICU or high dependency and requiring oxygen. So you do have a relief of your cough and runny nose a little bit better. Then there's no evidence for survival benefits, but there is some evidence to say that you do feel better. Okay, go on to the next question. If one has been infected in the past by COVID, by H1N1 in the past and recovered, would there be a degree of immunity against COVID-19? The answer is no. It's like I can speak Teochew. Actually, I can't. Okay, I can speak Cantonese, but it does not help me in learning how to speak Spanish because they are completely unrelated, very different. Someone may have come across the article which say that those people who went for flu vaccine ended up with milder COVID-19. Did the flu vaccine help with it? I think there is one important element which you didn't think about this. When people go for the flu vaccine, they are more of the they are very careful with their health. they are more they may have taken supplements, etc., and in turn they are more likely to have a better lifestyle, healthier lifestyle. And in turn, when they do get COVID, they end up having the milder form of it, because being healthy for COVID does make your disease milder. A simple case in illustration is obesity. If I'm very, very obese and my BMI is more than 32, I'm more likely to die from COVID than if I have a BMI of 20. Okay, so that will answer the question about anonymous attendee. We got Ice Pearl. Will long COVID ever go away? Yes. Ice Pearl asks, will long COVID ever go away? Yes, you can. It can go away eventually. I do have people who snapped out of long COVID. And this is the most encouraging thing which the doctor hoped for. They come back, we congratulate the patient, the person is out of long COVID, and this is it. This is done. Yes, you can actually get out of it. And ask, can fully vaccinated and boosted with Pfizer people get long COVID? And you are right, you can. Even if you're vaccinated and boosted, you still can get long COVID. But your chance of getting long COVID is about 50%, 50% lower. So I would still encourage you to get it. It's not foolproof, but you have lowered down the risk by 50%. Is brain fog pathological? The answer is we don't know. If you read the report saying that it can COVID-19 can destroy the brain with changes in the brain matter a few months later, you would agree that it is pathological. But where is it pathological? Why is it pathological? We don't have the answer. So the answer is it is, but we cannot describe it carefully at this point in time. Okay, we have an anonymous attendee here now. What are the differences when hit by COVID-19? I've seen healthy people get infected with COVID-19, is diagnosed with severe COVID-19. I've seen people with chronic smokers where they were asymptomatic. Does it have a different strains in mind in COVID-19? So why are there differences between two or one group of people with COVID-19? So the answer is there are several reasons. Number one, the virus. Some strains are worse off than the other strains. So that matters. So Delta, for example, is worse off than Omicron. I would choose Omicron anytime. Number two, it's actually the amount of virus that's transmitted across. If I only a tiny bit of virus that comes over, then my disease is going to be mild. So if I have a huge blob of phlegm that hits my face right into my nose, then with a lot of virus, I'm going to fall sick it's going to fall sick with more severe disease. So the second point is viral load, the amount that's transmitted. The third point is the individual's immunity. The individual's immunity will carry a lot of things, including the general health. Do you have good vitamin D levels? Are you the sort who runs around? Do you have pre-existing things like diabetes, mellitus, or kidney failure? All this will matter. And fourth thing is also about immunity. There are two individuals, where they're the same vaccines and they're literally twins, but one has a much better response with the vaccine than the other. Because when you throw the vaccine into the body, some of them do stimulate the immune system correctly, some don't stimulate it so well. So when the health immune system just responds differently, you could end up with different outcomes. So to answer your question, yes, you're right. There are many, many reasons for it. And if you really want to boil down to one question, it boils down to the individual's immunity. That helps to make a difference. And it's not to say that individual's immunity supersedes everything else. You can't rely on individual immunity altogether. So you do vaccinations to try to bring it up as much as possible. Okay, I got Risalans Dumas here asking a question. Can asymptomatic COVID patient eventually suffer from long COVID? The answer is yes. Asymptomatic COVID patients may suffer from long COVID too. But we don't know the figures. It's a bit hard to document all these. Because besides asymptomatic COVID, you could have other viral infections. practically any virus can give you a long COVID-like symptoms. So can we blame it on COVID because it's the COVID year? Well, there's so many other viruses happening at the same time. But coming back, Risana, your question is correct. Asymptomatic COVID patients can eventually suffer from long COVID. Anonymous attendee asked this question. When I feel better after 4 months, my long COVID symptoms suddenly got worse again when I catch a cold. Will this happen every time I catch a cold? This is a great question. This tells me that your immune system is a bit dysfunctional. When it sees a viral infection, it responds inappropriately to it. Yes, perhaps it can. The next time we catch a cold, you could actually have long COVID again. Short answer is yes, it may be bad again. I would suggest doing a full body screening, looking at all your systems and making sure they're normal. I also check on the vitamin D as well as thyroid function and make sure that all these are normal and try to get your results all within normal range. Then perhaps your immune system will be in the right place to get back to normal response. The anonymous attendee next asks, Dr. Leong, it was mentioned that shortness of breath and chest tightness are symptomatic of asthma as well. Will use inhaler alleviate the condition for those with COVID? Great question. It sometimes does. So we do have long COVID patients who have this breathlessness. Is the breathlessness due to asthma? Is the breathlessness due to airway sensitivity? And sometimes the inhaler has a placebo effect. So short answer for Cassandra is that the inhaler may help because there may be a real asthma or asthma-like condition. The second reason is that it may have a placebo effect. If the placebo effect gives the person the energy and the warmth to handle the day, I think we can just give it. Okay, anonymous attendee next. Dr. Leong, some news say you shouldn't take painkillers when you have COVID symptoms. Pain medications affect immunity to COVID. Not quite right. Not quite right. You don't take painkillers with vaccines because it will suppress your immunity to the vaccines. But certainly when you have COVID symptoms, you can take painkillers. So I do give a lot of anti-inflammatory drugs for my COVID patients. They feel much better, they rest more, they can rest better, and when the next morning comes, they can actually better fight the infection. Okay, so COVID, you can take painkillers, and I do like anti-inflammatory drugs. It helps a lot. Anonymous attendee asks, when should I get a booster vaccine after testing COVID positive? The answer is the longer it is, the better it will be. So there's a recent study to say that if you can wait to 6 to 8 months or 9 months for your booster shot, the results are even better. But can you afford to wait such a long time, knowing that after you have one COVID infection, you can be infected again, and then again, and again? So they would defeat the purpose of getting a vaccine or booster shot. So if you want to, the recommendations are to do it in 3 months. Why 3 months? Because it is very uncommon for people to fall sick again in the first 3 months. After 3 months, you can fall sick again. And I predict that every 6 months to 24 months, we will keep getting COVID-19. If you are living in a very sheltered place and you can afford to wait to 8 to 9 months, wait 8 to 9 months, then get your vaccine. If you can't and you need to lead a normal life like myself and anybody else, just take it in 3 months. I think that's good enough. Anonymous attendee next says, what can we do to help patients who are suffering from shortness of breath? Go and see a doctor. You may need to see a respiratory physician. Work out if there's any heart cause to it or lung cause to it. If you can't, then in that case, you have to build the person's endurance once from scratch. So you would need to train the person slowly, and in turn build up the energy again. See a doctor, respiratory doctor, look for other causes. If not, we just have to train up slowly. as if you are preparing for an Olympic competition. Catherine Chang say you have been COVID negative since 24th of September. Cough, breathlessness, asthma came back to. What medical treatment should I go for? When should I go for the booster shot? 2 questions inside here. Medical treatment, look into your cough and breathlessness. Since you guys are watching this channel, one clue is that very often they have airway sensitivity. So look out for airway sensitivity. A doctor can help you diagnose it. You may trigger asthma as well, and hence you get breathless. Number 3, many people get gastroesophageal reflux. So airway sensitivity, check for asthma, and check for gastroesophageal reflux. When you have reflux, it can actually give you the breathlessness. 4th is you might also be deconditioned because of the prolonged rest at home. So you have to train up again. So what you need to do is really to go and see a doctor, ask the doctor, do I have airway sensitivity, reflux, deconditioning? How can I get myself better? Okay, Felix Wong next says that he has taken 3 doses in Macau while there was no community outbreak. He's going to Europe for studies. Congratulations. Do you think there's enough antibodies to protect myself? The answer is no. You do not have enough antibodies to protect yourself. You see, the vaccine that was developed in last year was designed against the original strain. Since then, it has mutated. So in terms of your B cell matching is not good enough. You will get infected with COVID-19. You will. Since the virus has been mutated, the vaccine is less effective. You will fall sick with infection. However, since you are going to Europe to study, I presume you have something I don't have. That's called youth. If you have youth, you can actually protect yourself against a severe COVID-19. So I'm going to predict that you will still fall sick. You will fall sick, but you're going to end up with mild disease or asymptomatic disease, and life goes on as it is. So I'm very, very happy for you, Felix. So go and enjoy, and all the best in your studies. How long COVID patient can still be infectious to others? Nope, it will no longer be infectious to others. The rule is after 7 days, you are low risk of transmitting to others, but after 10 days, there's no risk of transmission to others. This applies to most people except individuals with the worst immunity possible. 7 days, low risk, 10 days, no risk. Anonymous attendee Nick says, does taking COVID-19 booster during active chemotherapy affect the efficacy of the vaccine? Yes, it does. When you're active chemotherapy, your immune system is down. That means you don't have soldiers to train. So your efficacy of the vaccine will be poorer compared to if you're not on chemotherapy. Okay. So anonymous attendee Nick says, do I need to get a doctor to diagnose for long COVID, or basically people with COVID history and manifesting those symptoms were not present before it means they're having long COVID? Even diagnosing COVID is difficult. I would rather you see a doctor and get help. If your long COVID is mild and you think you can cope with it, fine, by all means. But I would still like a doctor to confirm it for you so they can guide you along and support you along. Okay. Anonymous and attendee next, are there reports of COVID increasing the likelihood of heart issues like sudden cardiac arrest? I wouldn't say increasing likelihood. I would say that the risk of heart issues with COVID-19 has always been there. It isn't more, it isn't less. Yes, there is a risk of sudden heart attack, sudden cardiac arrest. So the risk is there and it will remain there for quite a while more. Daniel Lee asked this question, having read the decrease in vaccine efficacy for children under 12 years old in public reports, what do you think on this? Meaning there are more shorter booster cycles. You see, Daniel, when they ask about the vaccine efficacy, when asked about vaccine efficacy for children under 12 years old, they're looking to see whether the child gets infected or not infected. And if you think about it, with 2 doses for the adults, the efficacy is practically non-existent. But why then am I still interested in vaccinating the children? It's not about whether the person or child gets infected or not. It's about whether the T cells are trained adequately or not. mRNA is very, very good at training the T cell immunity. So remember B cell immunity and T cell immunity. B cell immunity, the vaccines won't work. Even if your CPAS is 96, 98%, it still wouldn't work because it is a different strain of virus now. But if your CPAS is 96%, your T cell is likely to be very, very good as well. And that's the purpose of taking the vaccine, to actually get the T cell up. Once my T cell is up, I have lower risk of getting myocarditis for the children. I have lower risk of getting long COVID. I have lower risk of even getting diabetes mellitus. So all in all, it's good. So Daniel, coming back to your question, it is not just looking at the vaccine efficacy in preventing infection, but does my child end up with severe COVID or not? Is he going to come out of it relatively unscathed? The answer is yes. Between 5 to 12 years old, you get vaccinated, your child is going to do better in terms of final eventual outcomes compared to a child that didn't get vaccinated. Okay, anonymous attendee next say, well, how does the benefit of COVID booster last for? The COVID booster does two things for you. Boost up your B cell immunity and the antibody levels will be very high, as well as train up your T cells. So your B cells levels will rise and fall with time. Fall with time and then rise with infection, fall with time and rise with infection. So at the end of the day, it's about your T cells are getting trained. So once your T cells are trained, you're going to end up with milder illness, 10 times lower risk or requiring ICU care. Anonymous attendee asked where to ask help for long COVID. Go to NCID, search NCID long COVID. They have a clinic there which can help you with it. Anonymous attendee says, I contracted COVID in 12th of February, scheduled for myomectomy on the 3rd week of March. Is this safe? Usually we like to have 6 to 7 weeks of rest between COVID and surgery. So you may want to talk to your gynecologist about scheduling it another time.
Thank you. Thank you very much, everyone. So there's really been a lot of questions and it's almost 9 o'clock. So we've got almost over 200 people actually, and we've got so many questions. So we'll actually be just collating all the questions that everyone has been asking, and we'll get we'll ask with the help of Dr. Leong, we'll get them answered and we'll post on our website. So you can just stay tuned at our Facebook pages. And then you can go in and take a look and to see whether your questions have been answered. So yeah, let me just do a quick wrap up. So thank you so much, Dr. Leong, for being with us today and to answer all our questions. I think all of us were very excited to have you on. And when we're here, everyone has been really actively participating and asking questions and interacting. So we'll be putting up all the questions that have been answered and also not yet answered on this platform. We'll get them answered also, and we'll release them onto our social pages. So if you have not subscribed to us at Medical Channel Asia, you can do so right now. So thank you everyone for attending and have a great night.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.